Hi everyone, Dan Julian here, nurse practitioner from Dan Aesthetics Medical, Premium Edition. Welcome. Today I'm showing you guys how to do a lip flip, and at the same time I'm going to show you how to lift the oral commissures of the mouth using botulism toxin. Let's get into it. Okay, so before we begin, let's just go over some basic anatomy. We're dealing with the orbicularis oris, which is a sphincter muscle, right? It goes like this, purses. And what does that mean? It means that you have to advise any clients that you're going to do that potentially for the next 3 to 6 weeks, they may have some difficulty pronouncing certain words or pursing their lips as much as they can before. They're not going to drool or anything, but they may have a hard time drinking from a straw depending on how strong of a dose you're using. And in this video technique that I'm showing you, this client only wanted the upper lip. And most of the time, that's all I really do is the upper lip. But if they want a little bit more of a show or a lower lip pout, then you can actually do 2 injection techniques below as well in the lower lip. And I'll highlight that with a picture here. And that's a possibility. Okay, so now let's talk about fixing the corners of the mouth. So we have 2 muscles here, the DAO, which is your depressor angular oris, and you have your DLI, which is your depressor labii inferioris. You don't want to hit this one, you only want to touch this one. And this one fans over it. So how can we avoid touching it? Well, look at the anatomy here. You see how it crosses under, but it crosses about midway? For that reason, I tend to stay higher and I don't inject here. Some people do inject Botox right here around the mandible region, but I don't do that because I'm afraid that the Botox is going to disperse and touch the DLI. I do a 1 centimeter over, 1 centimeter down, and I inject directly in. Make sure it's straight on, not angling forward, not angling back. It's got to be straight on, and that will ensure that the Botox stays where it needs to go. If you want to take an extra precaution, you can pull back the needle by about halfway and just inject superficially, and that will do a good job of keeping the Botox in that muscle. It's also going to further prevent it from spreading to anywhere you don't want it to go. I've always injected deeply. I've never had an issue doing that, but I also don't use too much Botox. You can use anywhere from 2 to 5 units here. I tend to use 3 or 4 max to prevent spreading. I also don't use Dysport here. I use everything else, but the reason why is because Dysport tends to spread a little bit more and increases your risk of spreading and touching a muscle that you don't want. The next thing I want you guys to think about is what happens if it does touch the DLI. How are you going to fix it? Should you fix it? Well, before we get into that, let's look at what would happen if you hit the DLI. Remember, these are 2 depressor muscles. So if it were to spread and hit the DLI, this is how a smile would look like. This would stay up, and this would compensate and drop even more. So if someone comes in looking like that, automatically your first reaction is, oh my gosh, I put Botox on this side because it's drooping. It's not. Remember, it's the opposite of what you think. This side kicks up, this side drops down. So the only way you can really fix it is either give them reassurance, this is going to pass. You know, if it's mild, ask them if you just want to let it go and it'll compensate and fix itself within 6 weeks usually. Or you can place 1 or 2 units of Botox right in the DLI and it's going to kick it up and match the other side. And it's not going to look too bad. Honestly, people aren't worried too much about showing their lower teeth when they smile. It's really the upper teeth. So if you had to fix that, that's a quick way to do that. 1 or 2 units and you'll be good. Okay, so let's get into it. Basically what we're seeing here is me identifying the markings for you guys. The first mark is going to be right at the tip of the philtrum column or the top of the Cupid's bow. That's where your first injection is going to be. Second one is going to be parallel with that. The next line that I'm doing is I'm taking the lateral aspect of the nose or the ala, and what I want to do is drop a straight line down and I'm going to place a point right there. The injection point is directly into the vermilion border, and I'm going to angle my needle slightly down to make sure that most of the product is into the lip itself. The other area where I'm marking out is, as I mentioned, is the 1 centimeter over, 1 centimeter down, and I measure it usually twice and then I make my marking. After that, I have her make a couple little depressive movements or frowning movements, and then basically I'm going to confirm that I'm in the ideal location. I placed 2, 2, 2, and 2, so a total of 8 units on top here. But remember, with that picture that I'm showing you above, you can also place 2 units on each area of the lower pillows below. Now the other way that you can do that is do 1 unit in each area, or you can focus only on the middle area. So the 2 pillows, the top of the philtrum columns or the cupid's bow and the bottom of the pillows here. Some people do that as well. So if you're looking for a milder result, you can do only these 2 areas and these 2 areas as well. And you can use either 1 or 2 units per area. Once that's done, then I'll go ahead and I will go ahead and measure out and do the depressor angular oris, and I'm going to inject exactly as I mentioned before. Another tip for you guys is whenever you're doing these 1 to 2 unit measurements, it can be tricky. And like I said, you need to be really accurate. You don't want to place 1 unit here and accidentally place 2 units here. It's going to visibly be noticeable, and it's also going to affect their smile potentially. So often enough, what I do is I will place 1 or 2 units in each syringe and have 4 different syringes ready for each area. Therefore, I'm precise, the client knows, and it's worth it. I don't recommend charging per unit whenever you're doing this because you're probably going to lose a lot of money. Just charge for the service itself. Therefore, you don't have to worry about product loss whenever you're doing all these little preps with the syringe. Now notice here, whenever I'm doing my injection here, how precise I am. I'm not angling it. I'm showing you guys that I have to be directly on 90 degrees and perpendicular to give me that the aesthetic result. And that's it.